Hi, I'm Dr. Ohad. Today I'm going to explain how CBT, or Cognitive Behavioral Therapy, can treat OCD. OCD occurs when you have an unpleasant thought and then respond to that thought with anxiety, and then try somehow to relieve that anxiety. For example, having a thought that something bad will happen to a loved one, and then feeling an urge to do things in a certain order as a kind of ritual so that it doesn't happen. In the cognitive part of CBT, you learn that all people have thoughts at times which make us uncomfortable because of fears that our thoughts may now come true or may mean we are a bad person for thinking them. Then, CBT shows you how to separate between thoughts that come from the logical part of our brain and thoughts that come from the emotional part of our brain. Once we know who is talking to us, we can choose who to listen to. In the behavioral part of CBT, called Exposure Response Prevention, or ERP, you learn that the more you try to escape your fears, the more you get used to trying to escape new fears as well, until you're stuck in a vicious cycle of fears and avoidance. But if you allow your unpleasant thoughts and fears to pass without trying to avoid them, eventually they diminish and then return weaker and weaker each time. After a while, it becomes much easier to tolerate your fears without believing or avoiding them. Research today has proven that CBT alone significantly helps up to 75% of people with OCD, and others may benefit from a combination of CBT and medication. If you'd like to know more, watch my other videos.